Welcome to In Focus with Ejaz Haider. Our top stories tonight are COVID-19 and the situation in Afghanistan. Let's begin with the pathogen. Over the past 2 months, we've been discussing the impact of this global pandemic from various angles. It's been a meandering course for experts as well as governments. Lockdowns opening up, lockdown again, essentially what some have called hammer and the dance. From many unknown unknowns, we have moved to known unknowns to a lot that we do know, but we are still outpaced by the virus. Alberto Zangrillo, an Italian doctor in the Lombardy region of Italy, the worst hit area, says the virus is losing its virulence. That, if true, is great news, except the Italian health ministry says, pending scientific evidence to support the thesis that the virus has disappeared, we urge people to continue to observe strict protocols. Another report quotes scientists in Europe and the United States as saying the relative success of lockdown policies means virus transmission rates may be at such low levels that there's not enough disease circulating to truly test potential vaccines. They're talking about moving to areas where the infection is being spread widely in the community. That would be countries like Brazil and Mexico at the moment, among others. In fact, talk of dilemmas. Meanwhile, Tokyo has issued stay-home alert after jump in new virus infections. Iran has witnessed the same spike after opening up. Brazil continues to be ravished by the virus. Here at home, we are witnessing a spike following opening up for Ramadan and Eid. Some analysts are suggesting another lockdown. Will that help, given the spread? To discuss the disparities and how the disease affects peoples and societies, we are joined by Sir Sharper Mirza. Dr. Mirza is an associate professor in the Department of Biology at Lahore University of Management Sciences. Her specialized areas relate to immunology and bacterial pathogenesis. We are also joined by Professor Derya Unutmaz, who's a human immunologist at the Jackson Laboratory. Thank you to both the panelists. Let me begin with Professor Unutmaz. Professor Unutmaz, here in Pakistan, India, Bangladesh, we have generally, and when I say we, I'm talking about the policymakers and also experts, that we have had a low mortality rate. Interestingly enough, a Public Health England report says that people of Bangladeshi ethnicity had approximately twice the risk of death than people who were white British. What exactly is going on? I mean, this report also says that the black people and the Asians are more at risk from this pathogen, whereas when we look at what's happening here, of course, there's been a spike, but so far, the mortality rate is generally low as a percentage.
Yes, it's been rather puzzling in some good way, actually. A number of Asian countries, including the ones that you just mentioned, but also, for example, in Middle East, in Turkey, in some other countries around that region, the mortality, at least the ones that were reported, were relatively low. I mean, significantly low compared to what we have seen in Europe, and in particular in U.S., where the healthcare system is supposed to be excellent, but still there was very, very high mortality. 106,000 people have already died in America. And in fact, as you pointed out, there's an overwhelmingly higher proportion of people dying, at least in the U.S., of colored origin, or African origin. And it's not clear why that is the case. And the Latinos or Hispanic minorities in the U.S. are also at higher risk. This could be socioeconomic status. There could be other reasons, health problems. But it's also conceivable that there's something more that makes them more susceptible for whatever reasons for virus to cause more severe disease. Frankly, we don't quite understand what's happening. One problem is that we're not sure that the reports of deaths are very accurate, and this includes most countries in the world, because this particular virus doesn't just kill you from pneumonia. It can kill you from heart attack or other problems. It seems like it's attacking many parts of the body. So it could be confused, or the tests sometimes come negative, or in some cases, the governments may not want to report the actual numbers of deaths for various reasons, for political reasons. So we don't have a complete picture to say what's really going on here.
Absolutely. I thought, I'm assuming unless every person who's dying in a hospital is actually tested, perhaps, whether he or she has died of COVID-19. Let me go to Dr. Mirza here. Dr. Mirza, once again, this Public Health England report talks about Chinese, Indian, Pakistani people from the Caribbean and Bangladeshis. Now, if there is something about the gene pool here which allowed for lower mortality rates or relatively lower mortality rates, how is it that the same stock elsewhere has a higher mortality rate? And as Professor Unutmaz said, this is one of those unknown unknowns. But what is your reading of the situation?
So I partly agree with Dr. Onasnab. I mean, there is a lot unknown in this situation, but fortunately, if you look at other infectious diseases, they tend to infect people in the same pattern. So, like for example, tuberculosis, there are some races that are quite resistant to tuberculosis, whereas others are more susceptible to tuberculosis. And you just mentioned something about gene pool. So partly it has something to do with the gene pool, but being an immunologist, of course, I'm going to look at it from an immunological perspective. And you have a gene in your body that is called HLA, and HLA represents certain MHC types, and those people, it's very possible that people and their bodies and their immune system are looking at this virus differently. And when they look at it differently, they respond to it differently. So some people, unfortunately, are more susceptible to it given a certain MHC allele.
Professor Unutmaz, going back to what I said, so we discussed this earlier also on this program, sort of multiple axes of attack by this pathogen. But if we were to test everyone dying right now, unfortunately, there is very high mortality in certain parts of the world. Would that give us correct numbers in terms of whether the death has been caused by the virus, or do you think that will not be possible?
Well, that's not going to be so easy because, the people who are dying also have other problems. They tend to have more hypertension, for diabetes, heart problems, and so on. They tend to be very old. So it could be that the virus obviously contributes to that, but it could be that they've just died because of another reason. However, that definitely would get us closer to the actual numbers. But there's also another problem.
Sorry to interject. I agree. I mean, all the talk about the comorbidities and the rest of it, but isn't it going to leave a signature which can be picked up?
Definitely, there would be a signature, in particular signature in terms of the immune response, even if the virus is gone at the time that you're dying. And actually, that's a possibility because, your body might have cleared the virus, but you still have the effects that your arteries could be blocked, or you might have a heart attack, but you should see the signs that you were infected. And also, you could do some statistical epidemiological studies. For example, in the U.S., there's been a huge spike in deaths in nursing homes, and many of those were not counted. It turns out that a lot of those people died because of COVID infection. It was completely unexpected, even if those were overwhelmingly old people, of course. So I do agree that testing could give us a better result. And in fact, even more importantly, I would argue that we should be doing more autopsies, and that has not been done enough, maybe because of biohazards. We can actually learn about the,
but there's also the issue
pathology.
There's also the issue of sheer volume of mortality here. But stay with me, Professor Unutmaz. We've got Dr. Mirza back. Dr. Mirza, please go on.
All of us have slightly different immune system, and each one of us look at pathogen differently. also we respond to pathogens very differently. And it's very possible that these people who are unfortunately succumbing to a more severe form of the disease may have a gene in them that is responsible for the severity of the infection, or they may have, so like for example, angiotensin receptors. So maybe they have more receptors which are associated with the organs, and that's why the virus is binding more to the organs and it is resulting in organ failures. Also, how the antigen is presented to the body. So different people present antigens differently. They present different antigens differently. And then based on how the antigens is presented to you, your body responds to it. So like the other doctor said, that there are so many unknowns in there. Somebody needs to do immunological profiling in order to understand how their gene pool looks like, how their immune cells look like, what kind of immune responses are upregulated in different individuals. Comorbidities definitely have a huge role to play, because people who have certain comorbidities, they already have impaired immune system. Like for example, people with cardiovascular disease and diabetes, they have low-grade chronic inflammation, and low-grade chronic inflammation, when challenged by a viral situation like this one, can really exacerbate inflammation. And I'm sure you must have heard in this case, there is a cytokine storm. So there is a storm of inflammatory mediators, which are actually resulting in the death in development of acute respiratory distress. So to cut the story short, yes, everybody is different. And some races are more susceptible to certain infections. The same is true for non-communicable diseases, that some of the races are more susceptible to non-communicable diseases. And it all depends on how our body and how the body of a certain races see a certain pathogen or see a certain threat.
Absolutely. Unutmaz, there's also the issue of immunity. Like, we hear about, for instance, the Spaniards under Cortes who went to Mexico, and the smallpox issue, which obviously impacted the Indian tribes but did not impact the Spaniards. And initially, when this whole thing started, there was a lot of talk about some kind of malarial immunity, the BCG injections, and the rest of it. Have we scientifically determined, is this thing now gone beyond just conjecture into some kind of evidence that these immunities are actually allowing sort of greater resilience against this virus?
I think it's quite different than those examples, because this virus doesn't really follow sort of what you would expect from individuals who have, as the previous speaker mentioned, you might have different immune responses. But when you look at, for example, the age groups, children or young people who would have this, in that region, the same type of immunity background, are not getting sick. So it's really only after a certain age you're getting sick. So I think it's not as simple as we wouldn't be able to explain it, that you would have certain genetic regions and you're predisposed to it. I mean, those could definitely contribute. I'm not ruling it out. But I should mention one other thing, as the previous speaker mentioned. There is an effect of the community or the environment that people live in. So, for example, in Pakistan, the people might be exposed to various pathogens that people in U.S. or other countries have not, and that actually trains the immune system in very.
Before I go, Professor Unutmaz, last time I spoke with you, we mentioned Sweden, and you said that they were taking a huge gamble, and it seems that strategy hasn't really worked.
Unfortunately, it hasn't. Per capita, the mortality is one of the highest in the world. I think in last count it was 4,000, close to 4,500 people have died. And what they were hoping was that the majority of the population would be immune by this time. But the latest screens with the antibody tests show that even in the highest concentrated regions like Stockholm, it was not more than 7% of the population. It's probably less than 5% general population. So you're looking at 10 times more infection or 10 times more mortality, at least, if not more, to reach so-called the herd immunity. It turns out that actually it hasn't really helped their economy that much either, because people were still scared to spend money and so on. So far, it doesn't look like it has paid off.
Absolutely. That's unfortunate, but that seems to be the fact. But thank you so much. That was Professor Derya Unutmaz speaking with us. Dr. Mirza, coming to Pakistan, there was a summary presented to the Chief Minister of Punjab. Apparently, there was a report, there was, across census blocks, and then, the average that was found was 5.2%, and then they extrapolated from there onto Lahore, and they said that over 670,000, if I've got the figure right, there are over 670,000 infections. Give us a sense of that report and that extrapolation, and what does that really mean?
So I think that the way the study was conducted was very reliable, because given the circumstances that you have so much infection at hand, there are so many people dying, I think that's the best that they can do in the given circumstances, and I believe that the numbers are very reliable.
So 5.2%, you think on the higher side?
I think 5.2% infection rate is really not high, and I think, and even if the infection rate is high, our mortality rate remained fairly low. And in infection, by infection, what they mean is that these people actually were carrying the virus in their nose, in their nasopharynx, but they didn't have any symptoms. So that's okay, because they must have built some sort of immunity, or they must have developed some sort of immunity, which is actually preventing the virus from getting into the lungs. At the same time, they could be pre-symptomatic also. But regardless of what the case is, this gave us the number of infections. And given the numbers that we are seeing in UK or in United States, I think our numbers are still fairly small. Although,
so this tell us about the policy option. So opening up is a better option, or smart lockdowns are a better option, because even in this report, there were some census blocks where the infection rates were like almost 70%.
So I think I would be very nervous. I would be very concerned about complete opening up. There has to be a smart exit strategy, which means that they need to come up with a very logical plan of exiting the situation. Smart containment makes a lot of sense, that you not completely locked down, but you keep an eye on, because these people are not infectious. I mean, they don't have active infection going on. They're just incubating the virus. But that, again, it's kind of a dicey situation, because having the virus in your nose means that you can develop infection at any time, and then you will be very infectious, which means that you can spread the disease to the other communities. So they need to be contained in a place. They need to be followed up. They need to have a very strong system of surveillance and contact tracing, because
contact tracing. So what is being called as TTQ, like track, trace, and quarantine. So, but that would require obviously a lot of effort. But thank you so much, Dr. Shapa Mirza, for speaking with us. We'll take a short break and return to discuss the situation in Afghanistan, where the coronavirus may be poised to impact the civil war situation. Stay with us. Welcome back to In Focus. Reports suggest that Haibatullah Akhundzada, the supreme Taliban leader, has been infected by coronavirus. He was being represented by Sirajuddin Haqqani, who's also been absent from meetings for some days. Interestingly, news outlets other than the Indian media are putting out the narrative that there is unrest and divisions among the Taliban after Mullah Yaqub, the son of Mullah Omar, took over as interim commander. Taliban sources deny this and point out that Yaqub has been selected to lead the Taliban military commission by Haibatullah himself. The Taliban Military Commission was a single entity until the death of Taliban chief Mullah Akhtar Mansour in 2015 in a US drone strike. The commission was divided into two zones, southern and eastern, to address security concerns. Yaqub will be leading both zones as an integrated commander. Meanwhile, several Afghan security forces personnel were killed in a post-Eid attack after the three-day ceasefire was lifted. There are still issues with the release of prisoners. COVID-19 is another threat. To discuss the situation, we are joined today by Rahimullah Yusufzai, the resident editor of the news and possibly one of the most incisive watchers of the scene. I'm also joined by Andrew Watkins. Mr. Watkins is Crisis Group's senior analyst for Afghanistan. Thank you to both panelists. Let me begin with Mr. Yusufzai here. Mr. Yusufzai, lots of Indian outlets are putting out stories focusing on the fact, and this is also being done by some outlets in the Afghanistan press, quoting some of the Kabul officials, that now there are divisions and no one really likes Mullah Yaqub as having taken over. Give me your sense of what the situation is.
I think we have to see as to who is saying what. So if the Indian media is reporting these divisions, do they have any access to Taliban? Do they have a presence, say, in places where Taliban are in control? That, I think, is the important fact. And if they are getting all these reports from the Afghan intelligence, the NDS, then that has to be subjective. So I don't say that, that Taliban leaders or members are not contracting, say, coronavirus. It can happen to anyone in any country. And I think Taliban are no exception. But the fact is that, we don't have any reports that because of coronavirus or because of Habatullah Khunzada contracting coronavirus or Mullah Yaqub taking over, there are divisions. I think one of the strongest points for Taliban has been their unity. And that is because they have one leader, one supreme leader, one shura, and there have been very few defections from Taliban. So I think that, we need independent confirmation of all these reports.
In fact, Mr. Yusufzai, you're saying, just to corroborate that, if there were in fact divisions, then we would not have seen a complete ceasefire for 3 days during Eid.
Yes, one of the arguments given by the Afghan government was that, we are not sure if the Taliban Shura or their office in Qatar can enforce a ceasefire, whether their military commanders or fighters will obey their orders. So that's why they said we want a ceasefire. And that will also show the peaceful intentions of Taliban. So I think Taliban have done that as well. When they announced a ceasefire unilaterally for 3 days during Eid, there was a ceasefire and everybody agreed. When they announced that they will be reducing violence for 1 week, as the Americans demanded, on February 22nd, 1 week before the signing of the Doha peace agreement, they abided by that. There were no violations, and the Americans acknowledged that the ceasefire or the reduction in violence was observed. Earlier also there was one ceasefire, the earlier one again announced by Taliban unilaterally during Eid. So I think they have shown time and again that they are united and they can enforce whatever they decide. I don't say again that there are no Taliban members or say some leaders who think differently, who are critical of the leadership. There was this split. The Mullah Rasul group was formed and they did not accept Mullah Mansour as the leader. But then the same Mullah Rasul group has now rejoined the mainstream Taliban. Also, we know that one very important Taliban military commander, Abdul Rauf Khadim, who also spent time in the Guantanamo Bay prison, he had joined the IS, the Daesh, and then he was killed in an American drone strike in Helmand province. So there have been some divisions or defections, but it's not large scale. It has not impacted the Taliban movement.
Okay, let me pull in Andrew Watkins here. Mr. Watkins, what is your reading of the situation?
Yes, I agree with Mr. Yusufzai. The Taliban is a movement that has always placed emphasis on unity within its own ranks and in developing consensus among its circles of leadership. This is particularly true after the events of 2015, which both of you have referenced. The death of Mullah Omar was revealed. The movement began to see fragmentation among its different factions and camps. Some were opposed to the new leadership of Mullah Mansour. But since Mansour's death by an American drone strike in Pakistan, the movement has clearly demonstrated that it has learned from this period of trouble and internal turmoil. And you see the movement increasingly guided by leadership by committee. Yes, you have Amir Haibatullah still commanding the obedience of all camps and factions within the Taliban. But you also see Emir Haibatullah, you hear reports and see evidence of having created a consensus-building style. And at these critical moments that Mr. Yusufzai has mentioned, moments when the Taliban has either offered reduced violence or ceasefire, we hear reports of large gatherings of Taliban leadership to discuss, to deliberate, and to come to consensus on these issues. And so when we come back to the question of the possibility or the rumors of Taliban leaders being infected with coronavirus, I think what we've seen demonstrated is a movement that is building resilience, even if leaders are affected, that may not affect the way that the movement operates as a whole.
Okay, so one of the sense that one gets reading these reports, and I think you will agree with me, we are in this world of communication, and the stories, the selection of facts, all of this have a certain kind of, or is possibly going to have some kind of bias against or in favor. So these stories seem to be coming from quarters that are not particularly happy with the deal. Now, we are not at this point talking about whether this is the best deal that Afghanistan could get, but it's perhaps the only deal at this point that could be gotten. So are we now looking at spoiler elements within the Kabul government? Do you think these are elements that could actually derail the deal somehow?
It's a good question. The concept of spoiler goes far beyond the idea of someone mounting an attack to threaten the progress of this peace track. And indeed, it can involve information or misinformation campaigns, simply the way that we talk about and frame the news that surrounds affairs in Afghanistan. And there are camps within Kabul, both inside and outside of government, and some among a great number of Afghans that are highly skeptical of the current track of peace efforts. And it's clear in the way that whether it's news of possible Taliban leaders being impacted by coronavirus or the latest United Nations report that details the interactions between Taliban and members of al-Qaeda, certainly there are interested parties in spreading misinformation or simply spreading rumors that can't be confirmed. But we should keep an open mind, even from within the Taliban itself. The Taliban is such a diverse movement, though it does emphasize unity and obedience. It is also a movement that does not make its own internal functions and debates transparent. And it's always hard to know where these rumors really originate from. simply because the movement doesn't make its own hierarchy open to the public. Okay. So I think we need to wait and before we pass judgment on where this is really coming from.
Absolutely, but I'm still emphasizing this. Go to Mr. Yusufzai here. Mr. Yusufzai, we know this because this was reported by the Indian press and also by some Afghan outlets. When Hamdullah Mohib last year went to Delhi, and he actually surprised his Indian hosts by asking them to send in troops to have some kind of agreement with the Kabul government. Now, that obviously is something that would be terrible, both for the deal going forward and also for geopolitical reasons, for the region. Now, the reason I'm referring to Mr. Mohib's request is because there are others also in the Kabul government. There's Amrullah Saleh, who contested on the ticket with President Ashraf Ghani. So I just want to get your sense of how far, because we certainly know that they are opposed to the deal, but how far can they actually spoil the atmosphere?
I think that this offer made by the National Security Advisor, Hamdullah Mohib, was an effort to show to the Americans that if you leave, we have some other option. The Indians can come in. But I don't think it was a serious effort. I don't think the Indians are interested. And I don't think that the Americans would, go along with that, just like that. I believe that, these are desperate attempts by people in the Afghan government. I believe that, there has to be a deal between the Taliban and the Afghan government and other Afghans who are also anti-Taliban. And the only way which has been found practical is this, that, okay, first the Americans and Taliban negotiate, make a peace agreement, and then we follow up, and there are intra-Afghan dialogue and other conditions. I think that direction is still being pursued. There are problems, we all know. There will be spoilers. But I think that, the Americans are very much interested that this should go forward. If they want to leave, that cannot happen if there is no deal between Taliban and their Afghan opponents. So I believe that, India is a very close ally of the Afghan government. And there are elements, say, in the Afghan government, as you mentioned, Hamdullah Mohib or Amrullah Saleh or even Hanif Atmar. They were all, in a way, they have links with the NDS. Some have actually served in the NDS. Amrullah Saleh was head of the NDS. Hanif Atmar was formerly a Khad official, and Hamdullah Mohib is now National Security Advisor. And NDS, I must say, is very powerful. I think that in the past we have seen that when Mr. Ashraf Ghani signed an MOU with Pakistan for cooperation between the two intelligence agencies.
It was NDS derailed that. Yes, Mr. Yusufzai, thank you so much for speaking with us. Before I wrap up, let me quickly go back to Mr. Watkins here. Mr. Watkins, human life at an individual as also a collective level is generally governed by the differential between the doable and the desirable, what should be and what is. Now, if we accept that, what is your sense of the deal going forward? Is this something, because, this is not something that can be reopened. Do you think that the Kabul government needs to follow this track now, because this track ultimately requires an intra-Afghan dialogue? So instead of trying to somehow, short-circuit this, to try and follow this track?
I want to go back to something that Mr. Yusufzai said that I also agree with. The idea that National Security Advisor Mohib's offer and engagement with India last year was more about messaging to the United States. I think this is a key theme when we talk about the difference between what is possible and what we hope for. When the Afghan government is playing a delicate balancing act between understanding the reality of the Americans' shifting desires and how it seeks to engage or disengage in Afghanistan, and what that means and what that leaves their options, but also seeking to leverage every way that it can the American engagement and leadership of this peace track. What I mean is for instance, the Afghan government's posturing on calling for ceasefire at certain points of this process before it engages in direct dialogue with the Taliban. This may be or may sound like a hardline stance and may come off at the moment as an objection or an obstruction to the talks moving forward. But we can already see that it has prompted additional periods of reduced violence. The 7-day period of reduced violence before the US-Taliban agreement was signed, this ceasefire that we've just experienced. And so we have to ask, is the Afghan government truly presenting obstacles? Or at some point, is it leveraging and pressuring in order to ensure that
I get your point, I get you, Mr. Watkins. I've also run out of time. The only issue is that it depends on how far one can go in trying to create space for greater leverage and when it can begin to redound to one's disadvantage. But thank you so much, Andrew Watkins, for your insight. This is all from In Focus this week. We shall see you next Monday at the same time. Keep following our latest updates on social media at indus.news. Good night and goodbye.